All right, so the second part of our healthcare systems unit is on government and nonprofit agencies. This is shorter than the last one, so thankfully, hopefully, it won't be as much of a brain suck, but we're just going to run through these few slides real quick. So, with these different agencies, we'll see that they're offered at an international, national, state, or local level. It really just depends on the agency. A lot of these are tax supported, which, depending on where you live, it may come out of your taxes. And they tend to serve a lot of different purposes. So, we're going to talk about some of the most common ones. First and foremost, the World Health Organization, otherwise known as WHO. I would make sure you know this is the international agency that's sponsored by the United Nations. You'll probably see that again. Some of the major things they do are put together those statistics and information on different diseases. They publish health information, investigate and deal with different health problems throughout the world. And their main objective is to achieve the highest level of healthcare for all people. The thing to remember with WHO is that they are an international agency. So when we look at some of our recommendations from WHO versus the CDC, which we'll talk about in a minute, you'll possibly see some discrepancies because, again, WHO covers the entire world. So they have to consider, for instance, recommendations on length of breastfeeding or recommendations on child growth. They're looking at statistics that come from all sorts of countries, countries that may be lower socioeconomic or that may have a higher rate of breastfeeding because formula isn't available or they don't have clean water to mix it with. So we just have to consider that that's why we might see some different recommendations based on the international perspective versus just what we have here in the United States. The United States Department of Health and Human Services, or USDHHS, is a national agency that helps deal with our health problems here in the United States. Their goal is to protect the health of all Americans, especially those in need. And as a result, they provide more grant money than any other agency, which is a pretty big deal. The NIH, or the National Institute of Health, does research on disease and they conduct scientific studies. So when you see some of these new vaccine studies or potential disease studies, NIH is going to usually be the one doing the research or the studies for them. Center for Disease Control and Prevention, or the CDC. Again, this is a US specific organization, but they're concerned with causes, spread, and control of disease in specific populations, whether that's the United States as a whole, or we've seen outbreaks of measles or polio. So, is there a specific population that those diseases are more concentrated in? Why and how do we fix it? The Food and Drug Administration, or the FDA, they're the ones that regulate all of our food and drug products that are sold to the public. Keep in mind specific things like vitamins or protein powder or weight loss supplements are not regulated by the FDA. So if you go and you pick up a vitamin at the store and it claims that it has a certain amount of a vitamin or nutrient in it, that's based on what the company tells you. That's not based on any testing or confirmation from any other agencies. They do help regulate medical devices. If you're familiar with any babies, there's a thing called the owlet sock that goes on their foot. It's supposed to tell parents if they're breathing and their heart rate's okay. The issue is it was being sold as if it was a medical device, which it's not. It is not regulated by the FDA. So they have had to stop selling those and reconfigure some of their marketing. They're not technically safe for sleep anyway. I'm not going to get on my soapbox about that. But medical devices, cosmetics, cell phones, condoms, things like that are also regulated by the FDA, not just our food and prescriptions. Agency for Healthcare Research and Quality, or AHRQ, is a federal agency. They have been established to help improve the quality, safety, efficiency, and effectiveness of healthcare for Americans, which I'm sure we will discuss a lot in this unit about how there's room for improvement in a lot of those things. OSHA, we will talk about at length. We already have, as you know, they do the safety standards in the workplace and then issue those limits for chemical and radiation exposure and then use of PPE. So when do we use it and what kind do we use? The Office of the National Coordinator for Health Information Technology, or ONC, they are helping build a private and secure network for health information exchange with a goal to improve healthcare by allowing information to be exchanged quickly between providers. We have talked and we will talk about electronic medical records, or the ability to have all of our medical information online. Whereas back when I was younger, a lot of stuff was still done on paper charts. So doctors had to either fax the information or print you a copy that you would take to the new doctor. And then they had to put in their system. And it just took much, much longer than it does today, where you give permission and it gets sent electronically. Bing, bang, done. Our state and local health departments, they provide services as they're directed to by the Department of Health and Human Services. We've talked a little bit about DHEC. They help provide for our state and for our community, again, vaccines or immunizations. They also work to do inspections for environmental health and sanitation. When you go by any restaurants and you see that letter sticker in their window, that's the grade they've been given by the health department, or DHEC. They help with controlling communicable or spreadable diseases. They collect those statistics and health records. For instance, they're responsible for reporting new cases of specific diseases like HIV up to the federal government to keep records on transmission. They do health education, and then they do clinics like we talked about for healthcare and prevention. Remember, all of these government agencies are supported by our taxes. So whether you pay state or federal tax, that's where some of that money is going. On the other hand, we have our volunteer nonprofit agencies, and these are going to be supported or funded by donations, membership fees, fundraisers, and grants. So we see that they provide, depending on the agency, health services at national, state, and again, local levels. A lot of times we see them deal with one specific disease or group of diseases. And some of the different things that they do are study that disease. They take some of this money that they get and help provide funding for research to find a cure or treatment. They promote public education. They may help with purchasing medical equipment or supplies for the people that they treat. They may have treatment centers like the American Cancer Society, I believe, has cancer treatment centers. And then they're going to help supply information on other agencies. So if they don't treat or discuss or know much about another topic or concern that you have, they're going to help give you information on agencies that can. Joint Commission, or you may hear this referred to as JCAHO if you ever go into healthcare. They're a nonprofit, US-based organization that was created to make sure patients are getting the safest and highest quality care in any of our healthcare settings. Not all hospitals are accredited by Joint Commission, but if they are, it's usually a symbol of quality because they've gone the extra step to meet these standards. That said, a lot of states are now requiring Joint Commission accreditation if the hospital wants to receive Medicaid reimbursement. So a lot of them that weren't previously accredited are kind of making the push to now get their JCAHO accreditation so that they can continue to receive Medicaid reimbursement. And then just some examples of the nonprofits we talked about that focus specifically on a disease: American Cancer Society, American Heart Association, the American Diabetes Association, Alzheimer's Association, the American Red Cross, Autism Speaks, and our National Mental Health Association. Now, this is a very small list. There are pages and pages of different nonprofits. Just keep in mind that they all exist. If you have any questions about government or nonprofit or volunteer agencies, please let me know. Otherwise, I will see you next time for our discussion on insurance.